Good afternoon, everyone, and welcome to another Cat Chat Live webinar. My name is Nancy Stevens. I oversee UK's parent and family communications efforts, and I appreciate all of you making time for today's discussion of Wildcat wellness. I know you have lots of questions and you're concerned about the physical and mental health of your student and want you to get to know a little bit more about just a few of the resources that we have on campus dedicated to supporting their physical and mental health. So you'll get a chance to meet some of my colleagues in just a minute. But for those of you who've done our Cat Chat Live webinar series this summer, you know we've got a little bit of housekeeping to take care of. First of all, many of you may be familiar with the Zoom webinar setup, but for those of you who may be new, want to remind you that we can't see or hear you. We do very much want your questions, and we'll spend time answering all of them after we see today's presentation. Please do use the Zoom Q&A feature to share your questions with us, and we'll take them at the end. Hopefully we can get to all of them in our allotted time, but if we do run out, you can always email parents@uky.edu, and we'll make sure that we connect you with these resources or answer any other UK questions you may have. This webinar is being recorded, and you will get a link to the recording in the next few days, and you'll also be able to view it in our Cat Chat family community. At the end of the webinar, you'll get a link today with a survey asking for your thoughts. As always, we very much appreciate the time you take to give us your feedback so that we can better serve you and your students. Our summer webinar series is wrapping up this week because we know everyone's thoughts are turning to move-in and K-week in the beginning of the fall semester. But we do hope you'll be able to join us on Wednesday afternoon for a conversation with UK Police. There is a link to register for that in the Cat Chat family community. There you'll also find the beginning of our fall webinar series. In early September, we'll be telling you more about what to expect during the university's annual Family Weekend celebration. I'm also at work with campus partners planning additional Cat Chat Lives for the fall semester. They will not be as often as this summer series. We know how busy everyone is, but you can anticipate the opportunity to see a couple of Cat Chat Live webinars a month moving forward, and we'll have additional information about that in the Cat Chat family community in the days and weeks to come. As a reminder, if you've missed any of the webinars in our summer series, you can find the links in the Cat Chat family community, along with ways that you can connect with other communities. You can update email newsletter preferences so that you can get those newsletters as often as weekly. You can view event calendars, easily ask questions and share information with your student. A lot of good features there in that, so I hope you're taking full advantage of it. One of the other things you can do in the community right now is register for the university's annual Family Weekend celebration. It will be a little more than a month away, September 20th through the 22nd, and on the Family Weekend website and on the registration page in the Cat Chat family community is all of the information that you need to make plans with your family. There's information about everything that my colleague Nikki Jenkins has planned, information on how to purchase tickets to the UK-Ohio University football game, and much more. So if you haven't done so already, I encourage you to check all of that good information out and make plans to attend. So those are all of my announcements and housekeeping, but I want to go ahead and turn things over to our colleagues. So today you're going to get the chance to hear more about TRACS, the Counseling Center, and University Health Service. And so my colleague with TRACS is going to kick things off, and I appreciate all of you being here with us today.
Thanks for having us. I really appreciate the invite. And my name is Paige Green. I'm the director of TRACS. And TRACS is a mental health program that started about 2 years ago now at UK. And the goal of that program was to be able to provide timely access to mental health services. And we coordinate services both on and off campus as indicated. Sometimes students come to us and they don't necessarily need therapy, but they have other things happening that we can get them linked to resources and help them be able to navigate our system. We have a lot of resources on campus, and so we try to help them navigate that. The way TRACS works is it starts with an appointment. You can students can make appointments via email. They can call. They can fill out a referral form, or they can walk in. The session lasts about 45 minutes, and we call it a triage evaluation because TRACS stands for Triage, Referral, Assistance, and Crisis Support. So students can be referred to appropriate resources. by meeting whatever they present to us in the session. We also can see them more than one time, depending again on what they need. And then we'll send them an email, follow-up email that has supportive resources in it as well. We often see students for many different reasons. Usually around the end of September into October, we'll see a high number of homesickness students who got to campus, very exciting at the beginning. And then when they start getting into the work, it starts getting difficult for them. And so we see a lot of homesickness. And so we get a lot of referrals for that. We also see things such as sadness, anxiety, depression, relationship concerns, loneliness. Throughout the school year, our students might experience some grief or loss. Some students might have some drug or alcohol concerns, disordered eating. If they've had a recent trauma or a traumatic experience that has been triggered, we see students for that. We also see students with suicidal thoughts, and sometimes people will walk in. We get about 3 to 9 referrals a month where students walk in. If it's an urgent crisis, we ask them to call 911, UKPD, or present to the nearest emergency room. But sometimes they get walked over by faculty or staff, or they'll come in and we'll get them in quickly so we can help evaluate and see what their needs are. We see some students that have anger management concerns or emotional regulation concerns. Sometimes students have experienced assault, and they can show up in our office, panic attacks or stress. And oftentimes we see a lot of the stress around November as we're going into the holidays, as we're ending, getting closer to the end of the semester. So I wanted to share just a little bit of data. Last year was our second year. Like I said, we had over 2,000 student appointments that were scheduled with us. We had 59 crisis walk-ins, and our busiest month was October, and then closely followed by November. We see twice as many females as we do males. And the reason I wanted to highlight this for families was because it's hard to know how students are going to experience this transition to school. And so what I could say is trying to be as supportive as you can and just listen. If you have any concerns, you can fill out the referral form as well, so they can get in front of a mental health professional and see what's happening. So we are open Monday through Friday from 8 to 4:30. We are located on the 3rd floor of the East Wing of the Gatton Student Center. This is our phone number that we can be reached at. We also can receive emails through tracks@uk.edu, which is if you wanted to schedule, a student wanted to schedule an appointment, they could email us. If you go to that referral link, you can fill out a referral for your student, but they can also fill out a referral for themselves. And then, like I said, and then they can just walk on in if they want to make an appointment with us. And then lastly, the link we have to our webpage has some different resources available, kind of explains some of things that happen for mental health. We have wellness apps that the university sponsors, and I think Tina's going to talk a little bit more about that, wellness resources, and then some smart documents that for specific topics that have links to a lot of different resources that you might find helpful, that you can help your student with, or that they can find helpful. And so I suggest that you take a look at that, and we're always open to feedback. So if you have any suggestions for us, we're happy to hear them. Thank you. I'll pass you on to Tina.
Hello, my name is Tina Bryant. I'm a licensed psychologist and I'm the acting executive director at the Counseling Center. I'm going to tell you some about Counseling Center services that are open to your students. Our services are free and confidential for your students, so just to let you know that. We like to think about meeting students where they're at, right? And so this means that, as Paige said earlier, that not all students need therapy. We do offer therapy, but we offer a range of services depending on what your student might be in need of. At beginning services, intake and referrals, we get referrals from tracks, right? So tracks may see someone and assess that they need to continue in therapy or receive some of our services. And so they'll refer them over to us for an intake, and we'll assess from there, like maybe they'll go into group or use some of our other resources. Self-care opportunities that we offer at the counseling center include our really nice massage chairs. The students really love that. We have a relaxation room that provides some quiet space. I'll tell you a little bit more about that in a second. We offer some apps, including Stress Busters, Wildcat Boost, and the university offers Headspace. Headspace is a meditation mindfulness app that students can use to reduce stress, as well as Stress Busters and Wildcat Boost. So those are some nice services that students can utilize for free. We offer some workshops. From time to time, we'll present on psychological topics across campus as requested, and we may also offer some in-house from time to time, and those will be available, the information on our website. We do consultation with students, caregivers, staff, and faculty. So for those of you who are out there right now who may have questions, concerns, or maybe we've answered your questions today, but something comes up later, please give us a call. We're happy to consult with you. Sometimes we get a lot of calls from family members who are concerned about their students and thinking like, how can I talk to my student about this resources available? How can I talk to them about my concerns? And we're happy to consult with you and be a listening ear. Because of confidentiality reasons, if your student is one of our clients, we can't confirm or deny or give you any information about their therapy unless they've allowed that. But we can always accept information. We're always happy to consult. We have an eating concerns dietitian who offers appointments as well. So those are for students who have some concerns around body image issues with eating in particular. And so those appointments are available for students. We offer a variety of support groups depending on some specific needs as they come up for students, as well as certain groups of students, graduate students who may need a place to find some support. We also have skill building groups specifically around managing anxiety, because we see a lot of that. That's a lot of what our students come in with. They identify anxiety as one of the leading concerns for them. We will have an ADHD skills group, and then also a skills group intended to reduce some symptoms of stress. We offer therapy groups for improving relationships and self-esteem. We're seeing a lot of social anxiety these days, and maybe you all are recognizing that in your students. We're seeing a lot of students who come in saying that they are worried about how others perceive them. They're worried about connecting with people. I'm not sure, some of this is related to COVID and the disconnection that came with some of that. And so now they're trying to figure out, how do I form friendships? How do I form relationships? Maybe I'm okay at meeting people, but I don't really know how to develop deeper relationships. And so our therapy groups really help folks work on those issues. And then we offer brief individual and relationship therapy. And I say brief, most of the time we'll see students from 4 to 6 sessions. And that just seems to be the way that things fall out in terms of them getting their needs met and what might be most helpful for them. Sometimes we will see folks longer, up to 10 sessions if needed. And if not, if they need more than that, then we're happy to help them get connected to resources outside of campus if needed, or other things on campus that may be appropriate for them. We do also offer after hours urgent phone care, and so you can call, a student can call anytime that our office is closed, anytime holidays, weekends, any of those university closings, that phone line is open, and that's our main phone line. So during the day, we answer that, and then after hours, there are mental health clinicians available for students to talk to. Another service that we offer is called Let's Talk. This is a drop-in service where our clinicians are out and about on campus, and students can pop in for a brief consultation. Maybe they've just had a bad day. Maybe they're trying to make a decision about something and they just need to talk with someone. So these are opportunities for students to just pop in and have a brief conversation with us. This is low risk. Sometimes students are nervous about coming to therapy. They're not sure if that's what they need. And so this is a good opportunity for them to stop in and share their concerns and meet one of us, right? We're just human beings and we want to be helpful to them. So these are some of the locations that we have. Again, this will be on our website. We have another one to be determined that will be in the International Student Center near the Lucille Little Library, which is closer to the Student Center. This is an image from one of our relaxation rooms. We have 2 of them because we have 2 locations. So one of our relaxation rooms is in 105 Mandrell Hall, and the other one is in 401 MDS building, which is near the College of Nursing and near Jacob Science. And so in those spaces, we have some quiet space. So you all may have students who really have some sensory overload sometimes and may just need a quiet space. Maybe they are maybe their roommates in the residence hall all the time and they don't have a private place to study or just sit and be to themselves. These are nice spaces for students to drop into, use the massage chairs, use the arts and crafts supplies, calming methods and activities for them. We usually have puzzles. There's light box therapy. So if any of your students experience seasonal affective disorder, they can definitely come by and use those. Again, we have some coffee, tea, and snacks as well, and just try to provide a little bit of a safe haven for our students on campus. These are 2 locations. So 104 Mandrill Hall is across the street from the law school across Limestone, and 401 MDS building, again, close to Jacob Science and the College of Nursing, Monday through Friday, 8 to 4:30. This is our 24/7 phone line. Our website, you can follow us on Instagram at UKY Counseling, and then that QR code will take you right to our website. So it's nice to be here with you all today, and hope moving goes well, and we look forward to working with your students. Here are some tips for supporting students. I forgot I had one more slide for you all. Stay in touch and give them some space. I know this is tricky. This is one of those things where, it's hard to find that line, but we really want you to try to figure out where it's the best place for you, right? So we do want your students to know that you love them and you're thinking about them, but we also know that they need some space and to, they're going to classes and they're meeting people, and we want to encourage them to do those things, to build their own lives here. Listen with curiosity. And not always to provide advice. I think it's hard. I'm a parent myself. It's really easy to jump in with some of that advice really quickly. And so sometimes you want to listen and be curious first. Ask them what they think they can do to address their problems if they have them. How can I support you? Those are really good questions, right? This gets their mind thinking. Eventually, we want them to be able to problem solve on their own. And so really, we just want to get that started, right? So you're the safety net, but you can also encourage them to do some of this critical thinking on their own. Refer to campus resources. There's so many resources for those of you who've been attending these webinars. I'm sure you've learned about a number of them, and we'll continue to learn more. There's so much here on campus for your students. Cheer on their successes, right? Even if it's small, right? Even if it's like, oh, you introduced yourself to a new person today. That's great. We want to be happy for them when they may have those successes. Validate their feelings when you can. It's again, very easy to try to minimize their feelings. Oh, maybe you're not that upset. Maybe you're not that anxious. And that is rarely helpful. And so validating their feelings when you can is very helpful to say, wow, I understand. I hear you feeling scared. I hear you're feeling nervous. That makes sense. Avoid minimizing their experiences, normalize their ups and downs. Some people come here and are so excited to be here. They love their time in college. It's wonderful. And sometimes they have downs too, right? And not everybody's going to feel like this is the best fit when they get here, and that's okay. Just because it doesn't live up to their expectations doesn't mean that it's not going to be a good thing. It doesn't mean that they're not going to grow into it. It's pretty normal to have those ups and downs. Take care of your own mental health. So, if you're feeling anxious, if you're feeling sad, if you're feeling, whatever it is that's happening for you, stressed with life in general, please be sure to take care of your own mental health. And I just encourage that for everyone. And complete the Get Help form, which Paige talked about earlier, if your student needs additional support. I think that's the end of my slides. There we go. Handing it over to UHS now. Thank you all.
All right, well, thank you. And happy Monday, everybody, and thanks for spending a little bit of your day with us. I'm Scott Black. I'm a physician and the clinical director for the University Health Service. And I'm joined in my office by a couple other folks that are going to do their best to keep me out of trouble today. So I'm going to let them introduce themselves to you.
I'm Charles Skipworth. I'm the practice manager for student health.
And I'm Jenny Lawson. I'm the nurse manager for student health.
And this is a street view of the University Health Service building as it looks from Limestone. We can move on to the, yes. And this is actually the physical location. So we're located at the south end of campus next to the medical center and actually attached to Kentucky Clinic. I like to walk around campus, and it takes me about 10 minutes to get from Patterson Office Tower to here walking. So it's not very far from the center of campus, but we also do have parking attached to Kentucky Clinic. There's a free parking garage there if students want to drive down here. You can see our posted hours as well as our appointment line are on this slide. Now, what do we do? Our primary services include primary care. So if you think about going to your primary care provider or family physician at home, we do lots of the same things. We also have a women's health specialty clinic. We have a nursing clinic that provides a lot of services, including allergy injections, and we do some compliance testing for the healthcare colleges. And then we also have a behavioral health clinic that works hand in hand with some of these other resources that you've heard about earlier today. Who can use UHS? Any full-time student who has paid the health fee can use all of our services, and most of those are going to be free, and we're going to talk a little bit more about that in just a bit. Part-time students can also elect to pay the health fee, and if they do, then they're seen the same way as a full-time student. And we also do have summer coverage that's available throughout the summer hours when most of the students are gone. Over the last couple of years, we've developed the ability to see people that have not paid the health fee at that time, and we can see them on a fee-for-service basis, just like a regular medical clinic can do that. Now, this is always a question we get a lot, and I thought it is important that we spend a little time on this. And on the left, you can see a number of the services that are covered by the student health fee. I think the most important thing to remember is that the office visit itself is covered. So whatever I do in the office or whatever one of the other providers, at least for the physician component, is covered by the health fee. On the other side of things, it's really draw your attention to the services that are not covered. And there are a number of things that the student health fee simply cannot cover, and that for that reason, we really encourage students to have health insurance to supplement their student health fee. And some of the things that they may need that aren't covered include a number of diagnostic tests. If we have to send them out for an x-ray or more advanced imaging, that's going to require health insurance to cover that. If they are really ill and they require hospitalization, they would need medical coverage for that. After hours care, I'm going to give you some resources later for a couple options for after hours care. That would require additional insurance. A lot of surgical procedures, if we have to send somebody out to a specialist, a number and most medications, and then of course vaccines. None of those are going to be covered by the routine student health fee. And we really, again, encourage students to have health insurance to cover that. We also have a triage nurse. If you have questions about that, Janie would be happy to answer those. But the triage nurse is available from 8 a.m. to 4:30 p.m. Monday through Friday. And she is there to help with questions. Maybe there's something that doesn't need to come in the clinic, but the student just has some questions about how best to treat that. She can help the students manage that at home. She can also help with scheduling appointments if they're having difficulty through one of the other scheduling processes. And we do try to call all of our patients and let them know about lab results that we need to talk about. Now, how do you get an appointment? We use Epic as our electronic health record, and Epic's one of the largest electronic health records in the country. So I suspect a lot of the students are already members or have Epic accounts. You know, an important thing to remember is even though we like to make appointments through Epic, the initial appointment needs to be made through the phone lines, because we're going to have to set them up a UK specific Epic account in order for them to be able to make appointments with us. So even if they already have an Epic account, the first time they make an appointment, they need to give us a call first, and we'll be happy to help them walk through the process to set up an Epic account. And then from that point forward, they can easily make appointments online or through one of the phone numbers. And those phone numbers are on this screen. Another thing to point out, though, is that the behavioral health services have a different appointment line than the primary care clinic. And then, like I said, we do have some options for after hours care. University of Kentucky Healthcare has 2 urgent care clinics that are not within walking distance of campus, but if students have a car or you want to take public transportation, they can certainly get to both of these clinics. Their hours are posted on here. They have online appointments, and they also have phone line appointments as well. And just important to point out that these clinics are not covered by the health fee. The only other thing I'd like to point out before we open it up to questions is that we understand that for many of you, this will be the first time that your student has been away from home for any significant amount of time. And I don't know how it is in your family, but I can think back to when I was coming to school for the first time. I had always relied on Dr. Mom to take care of a whole lot of things. And we realized that Dr. Mom's now a phone call or a FaceTime away. And no problem is too trivial or too simple. If the students have any question about that, we're more than happy to see them for anything they need. And again, the visit is covered by their health fee. So we fully understand that and encourage them to come in for questions or seemingly simple things. We're happy to work with them on those. And then the other thing is that you all may be aware of this, but the current generation of students, this may be one of the first times that our students are less healthy than their parents. And there are a whole bunch of reasons for that, but we understand that. And this is an opportunity as they're coming to college and they're starting to make decisions on their own to begin making, hopefully, informed and well-educated decisions. And that's the other thing that we're here for. We not only do we want to provide health care, but we also want to provide education for the students. And we want to spend time with them. We want to have the opportunity to talk to them about personal decisions they might make or choices they might make and how that would help inform their health and their well-being going on. And we're very happy to talk to students about that and again, encourage them to come in and ask questions about their health and their well-being. So with that, I think we're ready for any questions you might have.
All right, those questions have been coming in, and I suspect as we talk, more will come along. So we'll take those as we get them. So the most of our questions so far are for university health. The first one is asking if students can call and set up an account beforehand and not wait for their first initial appointment when they're sick.
Yes, they can call the helpline, the appointment line and get an account created.
All right. Do you all have a recommended timeline for doing that? So not everybody's calling at the same time?
It doesn't matter. They're there.
All right. And I assume that you want to hear from the students directly in that and rather than the family member making the call for their student.
Correct. The student needs to make the call.
No, that's what I thought. And the student may need a pep talk from a parent or family member before they make that call. But yeah, we want to hear directly from the student. All right, so that was our first question. We've got a couple of questions about HIPAA release forms, healthcare proxies, legal forms that they, about parents being contacted in the case of emergency. So if you all could speak to any processes or procedures around that, that would take care of a couple of the questions that have just come in.
Ann, do you want to take that one?
Was gonna let you take it. As far as HIPAA and what was the other questions?
A healthcare proxy.
Isn't that with the Epic? Skip, is that with Epic? Healthcare proxy?
So basically, the student would need to fill out those forms and have that release on file before we could do any discussions with the parent.
But there's an age to an Epic that is a cutoff. Correct?
Yes, I think it's 13.
Okay.
All right, so that's something that they would get set up through my chart.
They set it up through my chart, yes.
Skip, we have instructions for that, don't we? That we can lead them to?
Yes.
As far as setting up in my chart?
Yes.
Okay.
Yeah, and if you all want to send me a link, I can put that in the chat for everyone to be able to see. And while we're doing that, we've got a couple of questions asking about any required health forms. I think with any parent or family member in back to school time, we're used to having to turn in all the forms and all the things. So they're asking about any required health forms, any immunization records, and how they turn those in.
So for most of the public health students, any college of nursing, college of dentistry, pharmacy, health science college students, they will be assigned specific requirements by those colleges as to what they need to turn in. And they need to go to their My Chart under menu, and there's an option to upload immunization records. And to my knowledge, the only immunization that is required for other students who are not in health sciences or maybe education, those folks that are going to be living on campus need to be immunized for meningitis. And you can upload those forms on My Chart as well. But I would encourage the students to ask specific questions of their colleges. That each college has a compliance officer, and you can get in touch with those folks, or you can give us a call, and we can also set up an appointment for the student to come in and discuss their immunizations and maybe what they might need.
And I'm sure that for some of those colleges that do have more specific requirements, that's something that they'll be covering with them, and things like the college meeting that they'll attend during K-Week and so on. All right, got a question. If my student is on medication, can refills be sent to UHS for pickup, or do we use a local pharmacy?
You just need to contact your pharmacy and have that prescription transferred somewhere here in town, whatever might be the most convenient for wherever your student is living. We have a pharmacy right here in our building, which is very convenient. And there are several on campus, and there's Target down the way, which a lot of students use. We have several Kroger, CVS, and Walgreens around the campus as well.
And as Janie said, we have a pharmacy in the UHS building, and then there's another UK pharmacy actually in the student center.
Yeah, I just put the UK retail pharmacies link in the chat for everyone to see, but I feel like that pharmacy location in the student center has been a game changer for even employees and folks that are around. I know I'm there pretty regularly. And a lot of times I think students don't realize all of the over-the-counter things that they can pick up there, which I think are really convenient if they don't have time to get to something off campus.
And Nancy, I'll add, I think Dr. Black probably touched on this, but the urgent care that's out in Fountain Court, out Alumni, there is also a pharmacy there. So if anybody's living off campus near the Alumni Tates Creek area, there's a pharmacy there as well. It's right beside the urgent care clinic.
Okay, that's good to know. Yeah, and I've got those scheduling links in the chat for both of those urgent care locations that were mentioned. All right, our next question is about the student health fee and asking how that's billed to the student. It's in their tuition and fees, everything in their account statement, but want to confirm that with you all.
Yes, it's a mandatory fee assessed by the university for each full-time student.
All right, so that should be there in the account statements that students receive via email that first week of August. As you all have other questions, parents and families, make sure you're dropping those in the Q&A. I've got a couple that I know I've had conversations with families about over the summer. One is there anything that we haven't covered about how to prepare students for doing some of the managing of their own appointments and things like that? Again, as Dr. Black was saying, many of them have had families helping them prep for things. They may not be ready to answer questions about family medical history and insurance and all that. So anything else that you all see where students aren't quite ready? And is there anything that parents and families can be doing with these next few weeks to get them ready for those initial appointments?
I would just encourage any of the students just to give us a call, and ask questions that they might have. They don't know what they don't know. And we're aware of that. And most of us have our own children, and we understand. We just want to make this a safe place for the students. We want them to come here for their health care, for questions, anything like that we can do to help keep them safe while they're here. And of course, make moms and dads feel a little bit better about sending their students away. We want to take good care of your students while they're here. We just they ask us questions, and we will help them in any way we can.
Let me add, they need to bring their insurance cards also.
All right, good tip.
And-
Bring an insurance card.
And Nancy, I'll just add, well, I used to tell students or parents when I was in front of them, just to remind the students to get the important phone numbers in their phone. That way they're not shuffling to try to find it. And then make sure they know where we are. A lot of times students don't realize where we are and that what we have to offer. So take advantage of it because it's included in tuition, and take advantage of it, especially if you are far away from home. And then again, like Janie said, just call us. I don't care if people call me. If I can help a student some way maneuver around campus, or if they're sick or they need something, that's what we're here for. And we want to make sure these students feel like they can count on us to help them. So again, just have them call. I think Dr. Black probably talked about the PIN nurse line and what it's for, but then we also have our main line, and they can call and gather information. If they need, questions about what they need to do to be seen, we'll help them through that.
Yeah, I think everybody on campus understands students are doing this for the first time. And so, or many of them are doing it for the first time. So happy to help. Yeah, Paige, you had something you wanted to add?
Yeah, I was going to say one of the things that we see is as we're linking students to on-campus or off-campus resources, one of the things that they seem confused about is that if they come to school and they say, well, I have private insurance, my parents' insurance, but they don't know what it is. They don't know what it covers. I think just talking with them, and I know it's confusing, insurance can be very confusing, but really, for you as parents and then for the students to know as much as they can about what their coverage is. Because if they do get prescribed medication and then they can't get it filled, we see that quite a lot because then they don't have insurance that will cover it, or they're unsure what insurance they have. So we see that quite a lot.
And again, have them take a picture of the front and back of the insurance card and just keep it in their phone. Skip, they can put that in Epic just as easy, correct? Yeah,
correct.
so have them, talk to them about it, put that picture in there, and then they'll have it every time they come to check in.
While we're talking about health insurance, got a question that just came in. For out-of-state students, is there a health insurance that can be purchased?
Yes, there is. There's a student health insurance plan. Shabay Mock is the leader, as the administrator for that for the students on campus.
Yeah, and I've got that link in the chat that's there on your all's webpage, so folks can easily access that. All right, our next question is about tracks. For tracks, is the 45-minute triage eval just a one-time thing before they meet with a counselor, or does that have to happen every time?
That's
Yeah.
just a one-time. That's just a one-time evaluation. Sometimes it might be that the students thinking about what they need. If they we generally refer over to the counseling center. That's usually where we refer to the most. And usually what will happen is we schedule the appointment with the counseling center in this 45-minute session with them. So just about anything they're getting linked to, we will schedule with them in our session, and then they don't need to come back. They can always come back if they have some questions or anything like that. But usually it's just a one-time session unless there's a reason for them to come back and follow up. And we want to make sure that they got connected to whatever resources that they were referred to.
Our next question is back to University Health Service. Where would my daughter go to get a flu shot? Is it in the doctor's office, or do they do anything out on campus? So thinking ahead to flu season.
We will soon be offering flu shots. We'll be offering them here in our office, but we'll also offer them in pharmacies around campus. And so the pharmacy and the student center is a great place to stop in and get your flu shot, or any of the other pharmacies on campus. But they can certainly call us and we can make an appointment to give them their flu shot.
Yeah, whenever I see information about flu shot clinics out on campus, I always drop that into some of our parent and family communication offerings so that you all can nudge them to go get that taken care of. All right, our next question, it says, my student has a tree nut allergy. If they were to have a reaction, where is the best or closest place to go for fastest treatment?
So if it's an anaphylactic or really emergency, they need to go to the emergency department, call 911. If they have a severe allergy, they probably carry an EpiPen. They need to use the EpiPen and go to the emergency room. The next fastest place, if it's a less severe reaction and we're open, they can come in here. If they think to call ahead, that would be best. But if they can't, if they just come in, we will take care of them. They present at the desk having an allergic reaction, we'll get them back and take care of them pretty quickly. But again, if it's a severe reaction, we're not equipped to handle those as well as the emergency department could.
That's a good question and good to have a plan in place. So the next question that I would love Paige and Tina to speak to maybe is how families can encourage their students who may be reluctant to seek support. Maybe they're talking about being stressed, talking about feeling anxious, having some of the issues that you all covered earlier, but they're being reluctant about seeking any support for that on campus. What can families do to get their students to connect with you all?
I can talk first, Paige. That's okay. I would just, again, like normalizing how they're feeling. I think you can also have some curiosity there. What is it that's getting in the way, right? Like ask them what makes it difficult to reach out for help, what makes you hesitant to do it. Maybe they just don't know where to go and you can steer them in the right direction. Maybe they're feel like their problems are too small, right? Sometimes people feel like, well, I can't go bother a professional with that. I just have this tiny issue. Sometimes they feel like their problems are too big for anyone to help them, right? So being able to understand like what it is that's getting in the way for them can be really helpful in helping you figure out how to respond to them, right? And how to reassure them and say like the folks at Trax and the folks at the counseling center are used to hearing all kinds of concerns, right? Like we handle everything, right? From, what some people might see as a small concern to much bigger concerns, right? And so we're open to hearing any of that, and that's what we're here for. And just letting your student know that we're here to help, that we like to do this, that we want to work with students, we want to be helpful. I think those kinds of things can be really helpful. I think also if you've had your own personal experience with mental health professionals, particularly if it's been positive, but even if it's been negative, you can talk about that and say, yeah, I went to see a therapist one time and I didn't really love it, but here's what I wanted from that experience. And I hope you could have that experience too. Or, here's what my positive experience with mental health was. Or here's how I wish someone else in my life had gone to seek help. Just to offer some reassurance there and some encouragement. Maybe you can go with them if you're near. Maybe they have a friend who can go with them. Maybe they can pop into one of our less office-y kind of situations, right? Like let's talk or filling out the form and seeing what happens from there. So those would be some suggestions. And Paige, you might have some other ideas too.
The only thing I would add is that we, as well as the counseling center, see students virtually and sometimes as well as in person. Hands down, the students want to be seen in person more than virtually, but sometimes being seen virtually for that first step sometimes can be a little less scary. So they can fill out a form, they can make the appointment via email, and then they can be seen virtually. So it kind of makes it a little bit softer of a landing for people who are really concerned, really afraid. But we're really easy to access. And like Tina said, it's so important just to see if you can convince them to come in with them, come in with a friend. We see that all the time. So we're here to help.
And I would also say, Paige, I didn't mention that students also have access to Talkspace for free. And so they can have 2 free virtual sessions a month. Those are 30-minute sessions. So that's another easy way to try it. If they're not sure that they want to make contact with either one of our offices, they can also access Talkspace. And both of our websites have those links on there. Students will need to log in through their UKY ID and access services that way. So that's another alternative for folks who might be hesitant to come into the office and speak to one of us.
That's all great advice. So we have answered all of the questions that have come in. If anyone has any final tips or something that you were hoping to talk about or hoping there'd be a question about, want to give you all space to do that before we wrap things up. All right. Well, I'm so glad that our parents and families have had a chance to learn more about TRACS and the Counseling Center and University Health Service today. These are resources that we know your student will, have the opportunity to connect with while they're here on campus. And so want you to feel more comfortable knowing how to refer them to them, knowing who's behind these resources, and once again, hopefully being reminded of what a caring, supportive community you and your student are part of. Again, if you have any other questions after the webinar is over, you can always email parents@uky.edu, and we're happy to answer anything that's on your mind, get you connected with those resources on campus. We hope you make plans to join us for our final webinar of this summer series on Wednesday. That's at 1 p.m., a little bit later than some of our other offerings have been, but for that conversation with UK Police. We hope you'll take a minute and fill out the survey that you'll get shortly, and we appreciate your feedback and the time that you've taken to learn more about these resources today. And to all my colleagues on the call, very much appreciate you all making time to share all of this good information with parents and families. We hope everyone has a great rest of the day, and we look forward to seeing you again soon. Take care. Bye-bye.